Okay.
Hi, everyone. Welcome to today's live Q&A with the Integrity Health team. We have Dr. Keegan Zimba, Dr. Matthew Taylor, and Stacy Sosowski, registered dietitian. They are all the team at Integrity Health. They provide virtual integrative medicine, combining advanced diagnostics, precision medicine, personalized nutrition, and lifestyle care to help patients address the root causes of their health concerns and build lasting wellness. So we are going to have sort of a team conversation today about some questions that came in. So I will start with the first question. What annual checkups are necessary and what are not, such as mammograms, colonoscopies? Should they be every 5 years, every 10 years, gynecological? That's the question from our patient. So maybe Dr. Taylor, do you want to start?
Sure. It's a great question because it brings up the issue of how preventive evidence-based medicine works well. So the goal always being with these screening tests to not run like a giant fishing expedition, but to basically just update someone's personal risk profile and catch preventable diseases early. So also choosing screenings that are right for the person, for their age, their sex, family history, their symptoms, and personal values. So to run through some of the big examples, mammograms, for instance, generally not recommended annually for everyone forever. For average risk women, the US Preventive Service Task Force now recommends screening every 2 years from age 40 to 74. Some women with higher risk may do a slightly different plan, sometimes including MRI or earlier screenings. And some women with very low risk may have even other alternate screening regimens. So this one does have to be pretty personalized. For colon cancer, average risk adults usually start screening around age 45 and continue through age 75. Colonoscopy is one option out of the many screening options, usually done every 10 years if normal, not every 5 unless there are polyps or family history, inflammatory bowel disease, or another personalized reason. Stool testing is also a valid option for many people. And ultimately with colon cancer screening, the best test is the one that you'll actually complete. For cervical cancer screening, Pap tests are usually not an annual ritual anymore. The US Preventive Service Task Force guidance typically recommends Pap every 3 years from ages 21 to 29. For ages 30 to 65, there are more options. This could include a Pap every 3 years. It could include high-risk screening for human papillomavirus, testing every 5 years. Screening is generally not needed after 65 if prior screening was adequate and if there's no high-risk history. And of course, if there's been a hysterectomy where the cervix is removed, you're not going to need that screening unless there was prior high-grade disease or cervical cancer. And then probably the last big one to just mention is, regular gynecological care is really important, but a pelvic exam every year isn't really automatically necessary for everyone, especially if there are no symptoms and cervical screening is up to date. If someone has abnormal bleeding or pelvic pain, pain with sex, discharge, urinary symptoms, or hormonal-based concerns, that's different, but here you're going to evaluate the person, not the calendar. So the best question here is not actually what tests do I need every year or every few years, but what risks do I personally carry this year, and what screening has been proven to help someone like me.
Very interesting. I didn't know that you could check for colon cancer through stool testing. So Dr. Zimmer, Stacey, do you have anything to add to that?
I think Dr. Taylor really summarized the guidelines very well. I think it's important for us to recognize that we talk a lot about the personalized path in our field, and this is no less an example. Even although these are generalized guidelines, there's still ways to personalize them further based on your risk, and you're not going to see any single person have the exact same day-to-day, like year to year plan because of those different risks. So I think that's really important, that these are not just, generic write-offs. We are still taking into account who you are, what your risks are. And honestly, if you look at the trends over the years, when I first entered medicine, they were actually a lot more strict. And now we're recognizing maybe we don't need this test every year. We can do it every couple of years, and we're still going to pick up the same amount. We're not going to put people through burdensome testing. So I think that's really important too, to give credit to the guideline committees that are coming up with all of these things, that those are really important. They're not the end all be all though, as Dr. Taylor hinted at, that there are a lot more screenings that we do individually for our patients, again, based on their different risks, cholesterol being a great example of that. So I think that's the other thing to keep in mind.
Yeah, I mean, I'm not a doctor, but I'm excited about the idea that there's more risk stratification, and that, it's not just everybody at this age is of average risk and you have to get this test. I think we do really need to think about each person individually, and, if we're doing all of the right things from a lifestyle and diet and sleep and nervous system standpoint, and we're at the right healthy weight and no metabolic syndrome and our blood markers are good, then we can be considered maybe lower risk than someone who doesn't have all of those benefits. So I think that's nice as an option, because hasn't been that way always.
Yeah, awesome. Thanks, guys. We'll move on here to this next question. They say, what is your approach to persistently elevated ferritin when iron overload has been ruled out? And what other conditions should clinicians be looking for? So Dr. Zimba, do you want to tackle this one first?
Yeah, iron's a really interesting molecule. And why do we care so much about it? Well, it's a really important cofactor in binding oxygen in our blood. So without oxygen, we know we die, right? So the oxygen carrying capacity, the ability of our blood to carry that oxygen, is determined by how much iron we have as one of the factors. So we need it. And ferritin is one of the ways that we can check that iron. So a really simplistic model I like to use with a lot of my patients is we can measure iron straight up in the blood. But that's like checking what's in your wallet, what's in your checking account, what is immediately available to you on that debit card when you go to the store. Ferritin, on the other hand, is the storage form of iron in our body. So that's what you can access through your savings account or even your IRA or 401k. It's a little bit harder. You could technically get there, but it's not readily available quite as easily. So that's the storage form. You're keeping it saved for that rainy day. And we can, iron is really important to have as a balance in the body. Too little or too much is problematic. So this question, the asker is hinting at the problem with too much iron. Well, let's first step back real quick and just say too low iron is problematic, because that leads to eventually to anemia, not enough red blood cells, and therefore not enough oxygen carrying capacity. So that's when we get the really significant fatigue, and we can be pale because we have literally low blood counts. So that's really problematic. But we can also be iron deficient when we have low amounts in our savings account. Maybe we have enough right available in our checking account to get through day to day, but if anything happens, we have no savings account to dip into. And so that's where that low ferritin really comes into play. And on the lab tests, unfortunately, this is one of those where the lab reference ranges really don't match what's the optimal range. And that optimal range isn't just something pulled out of thin air. This is something agreed upon by multiple societies now, and big in the hematology world, that we're recognizing that a ferritin less than 50 for women, or even less than 75 for men, is iron deficiency. So that's the low side of it. But iron's also problematic when we have too much of it. It can cause harm to the body. We think first and foremost about liver disease as a big harm of having too much iron. So iron overload is a condition that does exist, and there are some people that are genetically affected, and we call that hereditary hemochromatosis. So that's out there, and it's something that we can screen for. We can test genetically, we can look at the iron counts, and we can look at something called the percent saturation to see if that's elevated. If that's not elevated, but say we look at that ferritin and that ferritin's elevated, now we're going to scratch our head. And that's the condition that this question is getting at, is where our saturation of iron in the blood is not too much, but that ferritin is still high. Why is that? Well, ferritin is a protein in the body that we can actually be something called an acute phase reactant, meaning it goes up when there's some sort of inflammatory phase in the body. So that's where our minds first go, is that we're thinking about inflammation and where is that inflammation possibly in the body, and what is that inflammation? And the degree of how high it goes up really kind of determines where we start to look. There are big jumps that can happen, especially if the ferritin's over 1,000, and that's going to be a pretty big workup, because there are some very significant concerning health conditions when the ferritin's over 1,000. I'm not going to get into those too much today, just because they're pretty rare, and also pretty significant. But what we more often see is that ferritin's mildly elevated. Maybe it's a couple hundred. If you're a woman, it's maybe creeping in 300s or even 400s. For men, a little bit higher than that, but it's never breaking that 1,000 mark. So that's honestly, first and foremost, we think about our metabolic health, and we think about chronic inflammation, things like chronic kidney disease, or chronic heart disease, these metabolic disturbances that we see along the lines of metabolic syndrome, or maybe there's diabetes in the mix. So these kind of inflammatory conditions. Or we start thinking about other types of things that can cause inflammation, like infections. So chronic infections are another big source of that. So that's where we start to look, and it's all going to depend on the history that you have experienced as a patient. Like, what are your symptoms? Where do we see those imbalances happening in the body? Do you have overt physical signs of something? And whether that's yellow discoloration of the skin that's going to point us towards the liver, or maybe that you have, a higher weight than, kind of ideal, that's going to make us think more metabolically. We're going to dig into those based on those other factors, but that's where we tend to think when that the ferritin is elevated, but it's not because of this excessive iron overload that we're worried about.
Wow, very interesting. I love the analogies. Makes it easy to understand. Dr. Taylor, Stacy, do you guys have anything to add?
I think that there's one sort of lesser common situation too that can happen with this high ferritin story that's worth mentioning. Also, as a point of just self-advocacy for patients who may find themselves in this situation, where there are symptoms of iron deficiency or fatigue, and yet the ferritin being very high can sometimes definitely be indicating a high inflammatory state, but may mask an iron deficiency. And in a situation like that, we'll sometimes order us a very particular blood test called a soluble transferrin receptor test. And it's something that is worth knowing about, and you can ask your doc about if you find yourself in one of these potentially low iron deficiency situations. What the test basically is looking at is, what is the body or tissue demand for iron? And if that soluble receptor test is elevated, that can be sort of a corroborative marker looking at maybe an iron deficiency situation, even when the ferritin is really high. So just another little point of self-advocacy to ask about that test if you think it's relevant to your situation.
Very good to know. Thank you.
My one extra layer of complication is that inflammation can also cause you to lose iron. So not only could inflammation cause you to have high ferritin, but it could also cause you to lose iron. So sometimes when and one of the things that happens with inflammation is that your liver sends out this hormone called hepcidin, which tells your gut to stop absorbing iron and also doesn't allow your kidney to kind of reabsorb iron back into the body. So you end up losing iron. And that is like kind of a case where even eating higher iron foods or taking supplements of iron might not really help enough because your body is still causing you to lose that iron. So finding that like trigger to inflammation is really the root for either that really high ferritin or even iron deficiency.
And I'd offer one more piggyback on that to say that in those situations where oral iron supplementation may not be useful, particularly since humans don't absorb a ton of iron in their gut on a daily basis, this is a point where your doc might offer iron infusions as a quick way to correct the issue. That's also quite safe. So something to just keep in mind when you're working with an iron deficiency kind of situation.
Very cool. Thank you guys all for helping with that answer. We're going to move on here. The next question is, are food sensitivity tests useful? So I'll start with our registered dietitian, Stacy.
Well, I'll first just kind of decipher between like a true allergy, which would be an IgE test, versus some of the more like popular tests that are marketed to test for food sensitivities, which are looking at or trying to look at IgG responses. So it's really two separate things. And IgE tests, yes, those are accurate. Those are true food allergies and would be accurately showing a person that they have that true food allergy. And those are some of the more severe allergies that you know of, where people will have a very severe reaction, not just kind of discomfort in their gut or not just little bits of, skin reactions. It's a very severe reaction. So that's that more severe food allergy with an IgE testing. I would say that the IgG tests are not very useful. And I don't know if everyone agrees with me here, but the reason is because when there's a level of inflammation in the body that is possibly triggering several different types of immune cells, and then you do that test, it is likely that it's going to connect inflammation with these foods that you're eating. So you get like a long list of foods and it seems like you are reacting to every single one of them, but really it's just because there was this high level of inflammation, kind of like a chaotic environment. And of course then when you test it with food, it seems like it's a connection between the food and the reaction. But I think that it could eventually show a person that they have this like high reaction to many, many foods, and it creates a little bit of a fear of food and even possibly nutrient deficiencies, because you start eliminating too many foods from the diet and you're not really getting to the root cause, which is what's triggering inflammation. How do I heal the gut lining and the gut microbiome and reduce that inflammation? And then you would take that test and it would show that you're not reacting to those foods anymore. So I don't personally find those tests to be very useful.
Yeah, I'll offer here that what a traditionally referred to as a food sensitivity test, or these IgG-based tests, is actually looking at is what we term a tolerogenic response. And what that refers to is a substance, cell, or a therapy that is inducing immune tolerance and training the immune system to not react against specific things. That's different than a pathogenic response, which is a disease-causing or inflammation-causing process. So that's just a really important difference, that an IgG-based food test is really looking at something that's tolerogenic, not pathogenic. And thus, I agree with Stacy that clinically they become less useful.
Yeah, I'm on board as well. I think that's our general practice here. There are a couple of studies that looked at something specifically called IgG4, which is a subset of the IgG class. And when they followed a food removal program with that, there was improvement, but it's not clear that that improvement came because that they were just getting rid of potentially processed foods and just eating a more whole food diet versus that it was the foods themselves. So I'm going to throw that out there because people do bring that up. And I think it's valid to think about and discuss and maybe even consider, okay, we've done a lot of work on your gut. We've done a lot of work on your body for the inflammation. Maybe now that we've gone down all these different paths, you're still having some symptoms. Maybe there's some utility there. To be honest, I haven't done it very often. I can't think of the last time I've done it. But I want to give some shout out to that side that there is maybe that potential specifically with the IgG4. If there's a test out there that isn't using that, then I wouldn't even consider it anyway. And the vast majority, 99.9% of people are going to get better, as Stacy alluded to, is working on those more root causes and working on a diet that is just whole food based and pulling out the processed foods, because that's what's going to trigger most people anyway, is probably, as we've discussed in past, contributing to a lot of the health conditions that we're seeing. So throwing that out there just to add a little counterpoint, but I'm still very much in agreement with my partners here.
Awesome. Thank you guys all for your input on that one. All right. This next question is, what supplements are must-haves and which ones should we not bother with? We kind of touched on this with iron, but Dr. Taylor, I'm going to shoot this one your way first.
Okay. I think a question like this deserves at least a gentle reframe of the question to start with. In personalized medicine, there are very exceptionally few universal must-haves for supplements. The real must-haves are always going to be sleep quality, protein adequacy, movement, sunlight, fiber, healthy relationships, not smoking. Supplements thus become tools, they're not foundations. And if we were to at least start by looking at, at evidence base, such as the U.S. Preventive Service Task Force again, and their review of vitamin mineral supplementation, we find that for most individuals and otherwise healthy adults, the evidence is often insufficient for broad disease prevention claims. That doesn't mean that there is some utility for personalized disease prevention claims. It certainly doesn't mean that supplements are useless. It just means they need to be chosen for a specific reason. So when we think about things like vitamin D, if you're low, you need it. If you're low in B12 or you're vegan or malabsorbing or on medicines like metformin or acid blockers, you need B12. We've talked about iron already. If it's low, you need it, and probably through an infusion type of program rather than orally supplemented. If you're low in omega-3 fatty acids because you don't eat a ton of fish or sources of that, you're going to need it. Probiotics even are something that a lot of people feel like they need to be on some sort of maintenance version of a probiotic, and that turns out not to be that true. It becomes more of a bugs as drugs kind of phenomenon where we're using these as specific strains in specific patients, perhaps with irritable bowel syndrome or some other condition, but these are not mandatory for everyone. So I think the answer to the supplement question is more about temporary situation-specific issues, and where you might have an acute issue like a cold or a viral illness, and using things that are very useful for targeted immune support, that's very different than saying everyone needs to be on those things daily. So again, I'll kind of end this with a reframe, some cautions and an action. The reframe again is not what supplement should every person take. It's better to ask, where is my bottleneck? Is it in deficiency, inflammation, sleep, hormones, metabolic risk, medication depletion? Where is my bottleneck, and is there a supplement that safely addresses that bottleneck in my physiology? To address some cautions, I think there's probably a handful, maybe 5 or 6 definite cautions I would offer. Number one is be really cautious about mega dosing antioxidants. That can not only imbalance cellular chemistry, but interfere with things like adaptive response to exercise. 2 would be random detox blends, especially where detox protocols are interfering with people eating real food. 3 would be any hormone supplements where monitoring isn't happening. You certainly need to be monitoring hormone levels if you're on things that affect them. 4 would probably be overuse of zinc, where copper awareness is not taken into consideration, and always, again, with monitoring, preferably red blood cell levels of both minerals. 5 is probably high dose iodine without thyroid context. Most evidence is suggesting that high doses of iodine cause more problems with the thyroid than it prevents. And if there's a 6th, it's probably something general like expensive stacks of supplements that someone can't tell you what outcome you're tracking. So that'll lead me to the last thing, which is an action step here, which is for every supplement bottle you have, once a year, you should bring them all to a clinician and just ask these 3 questions. What is this for? How will we know if this is working? And is there a reason to stop it? And if you can't answer those 3 questions, then it probably doesn't belong in your regular routine.
I love those 3 questions. That's so good to know. I also want to piggyback on this for anyone here, but how do you find a supplement brand that you trust, or is there one that you guys do trust?
So there's definitely a couple that we trust for sure. And I think it is a process of looking at the brand certifications and really you're looking for the quality, right? That's the biggest one, but you're also looking at the purity. And I say this kind of piggybacking on Dr. Taylor's call out of the massive antioxidant dosing and the detox blends. If something uses a proprietary blend, you don't actually know what you're getting out of it. So maybe it has one of the ingredients that you definitely want in there, but you don't know if it's 1 milligram or if it's 5 grams or it's a 10 micrograms. You have no idea because they can use that horrible language called proprietary blend. So you're going to look for things like third-party testing. You're going to want to make sure that they're doing toxin and heavy metal testing on the supplement, and it should be consistent across all of their products. You also is really kind of important is, there are a lot of white labels out there now of brands that we use and trust, but those brands allow you to white label. And so you have to be really careful that it is still the same, like the right brand for you. So there is a lot of trust placed in your clinician that is providing these to you. So you have to be mindful of, those third-party certifications and all of that good stuff. The last thing I'm going to say on this one is the Amazon piece. And in fact, I just saw another thing today on another article about there are some fabulous mock-ups on an Amazon marketplace of brands that you might regularly know. Now was one of the ones, Now Foods was one of the ones I saw in the picture, and the bottles were really similar. One had a blue cap, one had a white cap. And I had to look really hard and say, what do I remember, without, trying to give away the answer. And so that's really scary. So if you are going to go with, supplements, Amazon is probably not your ideal place. Yes, I get that sometimes you're like, I want to get it right away. I know it can be delivered tomorrow. Problem with that is you may not be getting the right thing and just not only wasted your money, but potentially put yourself in harm's way. So I'm going to call out the Amazon thing, but it's not just Amazon. It's all those big parties that you can purchase on those. So you want to get it from a trusted site that's going to make sure and ensure that you have the quality behind that. There's lots of brands out there that we use and trust pretty regularly. So there are definitely options out there that allow you to kind of look at the spectrum of, but if it's really inexpensive, there may be a reason for that.
Definitely some helpful tidbits there. Stacey, I'll just ask you, do you have anything to input on supplementation?
Yeah, just two quick things. One is that our bodies change over time, right? So even when something was right for you at one point in your life, it doesn't mean that the same exact supplement should be taken forever. So I think it is really important to, like Dr. Taylor said, ask the doctor, like, what are we going to be tracking? What symptom are we seeing change over time? And then when that gets better, when that symptom goes away, then you can know that we will be able to stop the supplement. So it's not that these things are supposed to really be just used forever, like sort of blindly. And the second thing is that it is really easy to fall for the marketing on a lot of these supplements. Like the label will say, this is, amazing for your heart health, or this is going to help you grow your hair back. And it's easy to just say, I really want that thing, and so let me just try this. But it's not so simple, right? So you really want to make sure there is some sort of research out there that's looking at a person who is similar to you, not a mouse or someone that's very different from you. It's, you want to look for a study that says this was used on people like you, and it, for 3 months at this dose, and this is how the outcome came. So it's not, we really shouldn't just be falling for the marketing, because it's really easy to do that. And it's a lot of times that could lead us in the wrong direction.
No, that's very good to know. A lot of really good digestible information from everyone today. So I really appreciate everybody. That does conclude our time though for this month's Q&A. And so I just want to thank everyone for joining us. And if you have any questions that you wanted answered from our team, please feel free to leave a comment in the section here on the video, or on our social media. We do have a questionnaire. You can leave an anonymous question there. And then if you're interested in working with any of our amazing doctors or dietitians, you can learn more about our team at tegrityhealth.com. So thank you everyone for joining us today.
Thank you.